Now, what happens if you have an enlarged prostate and we find out that you are having all of these symptoms? The question with the patient and the family is, well, maybe we won't do much because they may not want to go on some sort of medications, or they may want to change their diets or drink less before they go to bed. Maybe a lot of men out there drink alcohol or beer, which is very much diuretic and make them to go to the bathroom after hours. We need to cut that down after 5 o'clock and do most of your drinking during the day. But in general, if you have an enlarged prostate, you have a lot of these symptoms. We have oral medications. You've heard of Flomax. You've heard of many other ones, Cardura or Hytrin and other medications that we use. What these medications are doing is they are dilating the neck of the bladder and make you urinate much better. The flow gets stronger, you empty better, you don't get up in the middle of the night. I really like to talk to you about some of the new treatment options that we have for an enlarged prostate. We've spoken about oral medications or taking pills. Some people would like it, they want to be on the medication, but the trick is that once you're on the medication, you have to be on that for the rest of your life. And a lot of men in their 50s and 60s, not only they don't want to be on the medication, there's a compliance issue. And you know, who wants to be on medication forever, multiple times a day? There's a new procedure that has come called UroLift. And this is a new procedure that has been around for a couple of years. Thousands and thousands of this procedure has been done. There's a 5-year data to prove that there's certainly improvement in the symptoms. This is a fairly safe procedure, and it only takes about a few minutes in the operating room or in the office to be able to do this. So what exactly is UroLift? You know, instead of going in and trying to shave the prostate for much larger prostates, now what we're doing is using a cystoscopy, which is a look inside the urethra, inside the bladder. We're able to look at the lobes of the prostate, and where they are really blocking the path, we're able to basically put in some support or implants that really squeeze the prostate out of the way and open up a channel. This is a very smart, it's a very slick, and it's a very fairly easy procedure with minimum side effects. A lot of the issues with sexual function, retrograde ejaculations, and things that people have concern about, we're not seeing this with this procedure. And I urge a lot of men who have symptoms and don't want to be on medications for a long time, or they don't want to go for very aggressive procedures, to consider UroLift, and they can call our office at 212-365-5000, and we can give them a lot of information about this. This is a procedure that is short, doesn't require a lot of anesthesia. Patient can get back to work early. Over 90% of the time, there is no catheter after this procedure. So I think in our hands, the patients will do very well.